Hi, my name is Sarah, and I'm here to answer a common question to the University of Washington School of Medicine Office of Admissions, and that is, how many hours of shadowing do I need to apply? First thing I want to tell you is that shadowing is not required. The University of Washington School of Medicine does require that our applicants demonstrate an understanding of the role of a physician, but we recognize there are a lot of different ways to do that. So our committee is going to be looking at the clinical experiences and how applicants talk about their experiences and what they've learned. Here are some examples of the ways that applicants can gain clinical experiences. The key is that each applicant has to have some experience observing or interfacing with physicians. So the options listed here are ways that you can do that. There are more than these. These aren't the only options. And you'll notice that shadowing, both in-person and virtual, are on this list. But so are scribing, there's some research, there's some volunteering roles that interface with physicians, there are some patient care roles, and being a medical interpreter is a good way too. And these are all ways that applicants can learn more about what it means to be a physician, but also learn about themselves. And the most important thing that our committee is looking for, way more than the number of hours that you do any of these things, is your reflection. Reflection is when you write in your application what you've learned. And there are a lot of places to do this. You'll definitely want to include it in the experiences section, which is where you put all the things that you've done on your journey to medicine. But you can also talk about what you've learned in your personal statement, in your secondary essays, and during the interview. And we're going to want to hear reflection that are, for example, some of your insights in clinical care, what you learned about medicine and yourself. And please be sure to include any clinical experience, not just those that interface with physician. There are supplemental clinical experiences that you can explore that may not have that direct patient-physician relationship, but that give you some understanding of what it means to be a physician. And we encourage you to write about what you learned in those experiences as well. We have a wonderful page on our website that talks more about clinical experiences, what our committee is looking for, examples, as well as some great examples of reflection prompts that can help you practice getting the experience of writing down what you've learned from your opportunities, so that when it comes time to write your application, we have you can come up with some really great things to say. So that is, again, the clinical experiences page on our public website, and I put the link to that below. And as always, you can always reach out to our office directly. If you've looked at our website and you still have more questions, do feel free to reach out to us at askuwsom@uw.edu or our phone number 206-543-7212. Our website has lots of great information, and you can talk to us directly. You can find information about what we consider an applicant and how the process works. Feel free to look at our other videos here on our YouTube channel and follow us on our socials to find out about future events. Thank you.